All right, I want to welcome everybody back to Relevant Conversations in the Current Crisis. Again, our goal in doing this whole forum is to provide an online community where we can have some very relevant, good conversations to help us all deal with and cope and learn as to how to manage this pandemic in which we're all living and all the circumstances that surround it. And today we have with us Dr. Tuttle, who completed his medical training and residency here at the University of Kentucky. He also had his psychoanalytic training in Cincinnati Psychoanalytic Institute. He is an associate professor still in the Department of Psychiatry at the University of Kentucky. He is a member of the Cincinnati Psychoanalytic Institute and as well an associate in the Bioethics Committee at UK Healthcare. So you've got quite a bit that you're involved in, Dr. Tuttle. I'm always intrigued by that biomedical ethic committee at UK Healthcare. I was part of a biomedical ethics class at Transylvania, and it was one of my most favorite classes. But you also have a you're a psychotherapist and a psychoanalyst here in private practice at Lexington, Kentucky, and it's really good to have you, and I appreciate that you're willing to share that time with us today. So thanks for being here.
Oh, thank you for the invitation.
I appreciate it. Well, we've called this particular episode a second pandemic, and that might intrigue some as we say that the coronavirus mental health care crisis might seem like kind of a downer to think about that as we kind of title it that way. But I think the goal here in our conversation today is really, number one, to try to bring a greater awareness to what we know now this far into the pandemic and how some of that information has changed. But at the same time, we acknowledged earlier that the month of May, for quite a long time now, since 1949, as I mentioned in the invitation to this, is kind of a national mental health month as we try to bring awareness to mental health issues and mental illnesses. And part of the whole process of making a whole month bring awareness to mental issues is to try to bring the stigma down on mental health care or mental illnesses. And now that we're into this pandemic, and we as a society and even globally, for sure, are facing this crisis, I think it even heightens that awareness that much more. So hopefully we can kind of speak to that today as well. But one of the graphics that I saw earlier today that I was kind of looking at mentioned the fact that as we're dealing with a pandemic like this, that there are certain responses to that pandemic on the front end to where we kind of reach a peak in dealing more with the trauma of this pandemic. But at the same time, now that we're kind of into reopening society and everybody getting back to some semblance of being able to interact again, that there's a possibility that we're going to enter into this valley or this trough. And then we're going to try to find a baseline again as far as our response to this pandemic. And so I think it's pretty important for us to try to understand, things that have happened on the mental health side of things, both at the very kind of peak as we're kind of dealing with the front end of the crisis and the things that you've seen there, as well as to kind of maybe help us understand what we're going to see as we try to face this valley that we may experience as we're kind of used to it and we're kind of coming out on the other side of this pandemic to try to find out what life's going to be like and how we're going to respond to it. So what have you seen in private practice and in the things that you have been seeing as the statistics have come out and the research has come out that you can enlighten us on as far as how we're responding to this pandemic, the things that we need to be made aware of, and how this is affecting more than just people who have had mental illnesses and mental health cases on, even before the pandemic happened, and what we're seeing as far as the rise of that's concerned.
Yeah, absolutely. I do think it's crucial to appreciate that this is a crisis that we are still in the midst of. A colleague of mine, who's a trauma surgeon, described this as a mass casualty event that is unfolding in slow motion. And we are still in the midst of that. People are still dying. We are looking more hopefully at reopening, but the bombs are still falling in this, and it is having a profound impact on all of us. And I think your point is actually well taken. It's not just affecting those who have a history of anxiety or depression. But this is a tragedy and trauma that is affecting all of us. Now that we are probably about 2 months into quarantine, social distancing, isolation, we've now had enough time to actually begin to do some research on the effects that this is having, both in the community here in the United States, but also beginning to look at the effects of frontline healthcare workers that have been struggling with this pandemic for a longer period of time in China.
Well, so what are we seeing as far as some of the, I guess, reactions to this pandemic and social distancing and isolation and quarantine? Of course, one of the things that we hear repeatedly, and I think it kind of exacerbates the problem, there's a certain amount of this that we have to be realistic about. But when we start to hear words that are repeated over and over and over again, I think it might tend to lead itself to some unrealistic reactions to this as well. But you have words that we see used quite frequently now in just about everything you hear and read. So you have unprecedented, unchartered, uncertain, and those three words, those three phrases seem to be used and exacerbated in this situation. And of course, I think some of that is to come to grips with the fact that there's going to be a new normal. But what kind of reactions are you seeing? I mean, how are people responding and behaving to this crisis that we need to be aware of just on every level so that we can better cope, we can understand, we can be more empathetic to the people that are around us?
Yeah, absolutely. And I think there is a normal reaction to quarantine. Insofar as that quarantine is really not a normal experience for any of us. We're all very social animals. We need human contact and connection to maintain our mental health. But the quarantine and distancing, are inherently stressful to all of us. We're all reacting in idiosyncratic ways that depend on who we are, our personalities, our past experiences, our own histories of trauma. But there are a couple of unique features that I think, or unique facets of this stress that are important to keep in mind. One is the duration of the quarantine. We know from extensive research that the stress of isolation correlates heavily with the duration of that isolation. Now, most quarantines are a defined period of time, say 14 days or 21 days. What we're facing now is somewhat unique in that we are looking at a lot of uncertainty in how long we have to maintain this lifestyle. That uncertainty adds a lot of fear and anxiety to the stress that we've already undergone. There are a lot of, I think, normal fears that we think about or face. Probably the most notably is the fear of infection. A Washington Post survey that was actually just published this week pointed out that 60% of Americans have significant fears of contracting the virus in a workplace environment and passing it on to friends or family. An interesting caveat to that is that when you divide those among Democrats and Republicans, those numbers widen between 66% of Democrats worry and 47% of Republicans worry. And this is, it's a unique pandemic in that anxiety seems to fall across partisan lines, which to my knowledge is something that we have never looked at or done any research with. Frustration and boredom are widespread. And that in turn causes, especially among a lot of the people that I work with, a lot of self-loathing and self-hatred. Those who are very driven, usually professionals, people that deal with their anxiety through productivity, find that has ground to a halt right now. A lot of people have the fantasy or belief that they should be highly productive. They have a mental list of projects that they feel like they need to accomplish during all of this free time. And I think that's unrealistic. I think we need to give ourselves permission to not have checklist obligations to take care of other day, and to give ourselves permission to be bored and sit with ourselves. But for a lot of people, that is not an easy task. A lot of people also have fears of not having adequate supplies at home, whether it's food, medications are a major concern. And this is something that falls heavily across socioeconomic lines as well. I mean, those on the higher end of the socioeconomic spectrum usually have the resources to have groceries shipped to their home, to stockpile medications, to have friends and families help with necessary errands. Those on kind of the lower end of the socioeconomic spectrum might not have those same types of resources. So filling a cabinet full of food at the end of the week becomes something extremely stressful. Also, another significant point of stress actually revolves around the quality and availability of accurate information about what is going on. These are not the days of Walter Cronkite where we all share the same news feed or the same source of information. I personally have been very surprised at how much, not only bad information is out there, but how conspiracy theories have really taken root and affected a much larger percentage of the population than I would have guessed otherwise. There are possible explanations to that, but I have found that to be extremely worrisome. And then obviously fear of finances are a major concern for a lot of people, especially the 20-25% of the population right now that have fallen in unemployment lines.
Well, speaking of the unemployment line, let's bring something else to the attention, because if you go
Absolutely.
back to 2008, when we kind of experienced the recession there and the financial crisis, some of the studies that went back and looked and found that there was somewhat of a correlation. Well, they're not somewhat, but there was a definite correlation in suicide and mental illness compared to the unemployment rate. And I think I was really shocked to find that for every 1% rise in the unemployment rate, there was a correlating 1% rise in mental illness and suicide. And so that's a shocking statistic when you think about that. And right now, the unemployment, goal is higher than it's been in our lifetimes. And so what are you, is there any more research that's coming to bear on any increased rates in mental illness as a result of this and suicide?
I'm not aware of anything recent. I'm glad you mentioned that study. It was a very pivotal study that was published in 2014 based on the 2008 economic data. That study has been cited several times recently in our attempts to estimate the potential suicide rate of unemployment. And that rate has recently been estimated between 10 and 20,000 individuals. And if I remember correctly, I think that estimation were of suicides of individuals who are attempting to take their life. If you add in accidental suicide related to drug overdoses, that number can double. Wow.
Well, that's another reason to kind of bring even more awareness to this and to have an open conversation about it, is because, one of the things that we're trying to do, and one of the things that I think is happening to some degree as we're all kind of facing this crisis, is a more open awareness of the effects on other people. And, the governor's been encouraging us to do this, and we've been encouraging each other to do this, is the sense of the need to be able to check on other people. And I think in one degree, we do that just in case there's some needs as a result of the unemployment, as a result of isolation. But I think thinking about the increased potential in mental illness that would happen, during this crisis, and as well as suicide, it makes it that much more critical that we kind of get back to our humanity and understand that even in isolation and even in the social distancing restrictions that we're all having to live under, it's much more reason that we need to be cognizant of each other so that we're aware more of maybe some of the tendencies that we're seeing or some of the signs. Are there things that we need to be looking for? Or what are the signs? I guess there's a normal anxiety and normal fear, and those things are helpful in many ways. But when do we get outside the bounds of what's normal? What do we need to look for?
Yeah, and I think it is an important question. And I know you commented at the beginning of the webinar that this is a gloomy topic, but I would add that I think there is a silver lining, that unlike COVID-19, We have decades of research and understanding of depression and suicidality. The screening tools, preventative measures, all of that is in place. And it's something that I think we can fall back on very aggressively if we, as a community, decide to put resources into that. But back to your question, where do we draw the line between normal anxiety and regression that we expect all of us to experience versus a pathologic anxiety or depression, that is, an experience in which we need to intervene or seek treatment for? As you can imagine, it's actually a very complicated question.
Oh, I can imagine.
Partly because, partly because distress is a very subjective experience, but it's probably the most important one with regard to, our need to seek help. Like with physical pain, we all have different tolerances for sadness or anxiety. But there are, certain warning flags that we look for and listen for is in order to then consider taking the next step and getting an evaluation or screening more thoroughly for a potential problem. The most significant is suicidality. I mean, any individual who is experiencing suicidal thoughts or is actively suicidal, that's problematic. In no world are suicidal thoughts considered to be normal or healthy. Extreme anger and irritability is often a presenting sign of anxiety and depression, especially in these types of contexts. It's usually the hallmark symptom that we look for in children, but significant changes in adults' levels of irritability or aggressiveness is also kind of a major warning sign. Avoidant behavior is another major concern. Friends and family who begin to withdraw, or if we notice ourselves just disconnecting from any social contact. Significant increases in alcohol or substance use. I mean, a lot of people that I work with have noted slight increases in their alcohol use. That doesn't necessarily mean it's problematic, but it is a slippery slope. A lot of people are drinking more out of boredom, but many are drinking more heavily as a way to cope with anxiety or depression. And that becomes a vicious cycle. I remember reading a report here in Lexington from a couple of weeks ago, I think it was in the Herald Leader, saying that Wines and More, their home delivery increased 800%. That doesn't necessarily translate to alcohol consumption increasing 800%, but it did stand out in my mind that a lot of people are drinking much more heavily now, and it's something that we need to be aware of as a potential problem. Other major warning signs include significant changes in appetite, sleep, energy level, concentration, what we typically call neurovegetative symptoms, which are commonly seen in severe depression. Now, right now, they can be problematic because I think we are all experiencing restful sleep. Our sleep quality is decreased. A lot of people are commenting that their dreams have changed. They're either more vivid or they contain themes of infestation or infection. It doesn't take a psychoanalyst to interpret those types of experiences. But sometimes that sleep can degrade to a point where it greatly interferes in day-to-day functioning. And those are typically signs of a need for further investigation or an evaluation.
Yeah. Let's get back to one thing that you mentioned earlier, and that's in how we kind of all respond differently to this. And I read somewhere, and I thought it was really interesting, that regardless of whether you think, for example, that you're experiencing some of these stressors or how you're responding, we're all responding differently. But the fact of the matter is we're still affected, and we're probably still all experience some kind of emotional or psychological distress in this, whether we are conscious of it or not. And I heard one study that talked about the fact that we're all at some level experiencing even grief, at this point in time. And I think I guess one of the things that have been suggested, and I think you mentioned it earlier, is really kind of a taking a step back and really trying to evaluate ourselves and how we ourselves are responding to this. When you mentioned some people don't have work to go to get into those daily routines that somewhat are an escape or keeps them productive and keeps them mentally healthy. In my work right now, it's business as usual. Well,
Right.
not business as usual, actually, because right now I would have a break. And I've not had a break. I've not had any kind of break or any kind of vacation or any kind of days off. I haven't, and I'm not complaining about that. And but one of the things that I finally realized about myself, so I took a step back, and yes, there's the stress of work that continues to go on because we're considered essential as CPAs. And with the fluidity of the tax law and the guidance right now, we're having to really continue to drink by a fire hose. And we're trying to deal with the delayed tax season. One of the things that I realize how much I have missed something in this whole thing, and I realize it's changed and affected my disposition, is the fact that there's no points of escape for me. So it's either straight to home or straight to the office.
Mm-hmm.
And usually my routine used to consist of, finding some little corner in a coffee shop for the first hour and a half in a day, at least 2 to 3 times a week, that I just had by myself, and I could get off and I could go off to read or to just kind of decompress. And those opportunities to do that aren't as much or as frequent as they are now. And I realized that that's really kind of starting to affect my own disposition, toward my family, toward my peers, to my colleagues. It was subtle, but I started to realize that, even those kind of things, just not realizing the effect that it's having on me. And it's probably true for all of us to some degree, I would imagine.
Yeah, absolutely. I mean, one way to look at our personality is that our personality is a constellation of psychological defense mechanisms. Those are the psychological strategies that we use to deal with our own distress, anxieties, fears. They include, colloquial experiences like avoidance or denial, projection, displacement, all of these terms that, become essentially kind of incorporated into our culture and help us understand ourselves and how we regulate our emotional life. For the most part, we choose professions, we choose partners that work with our defense mechanisms like puzzle pieces. We like to, put ourselves in an environment and create a life that works well for us, that doesn't rock the boat. The problem that we're facing now is that the boat has been capsized. That carefully arranged world that we create for ourselves is no longer adaptive to us. So, those of us who say deal with anxiety by avoiding certain topics or kind of by overworking, for example, like a lot of professionals do, may not have those outlets anymore that they have historically relied on to deal with anxiety. So without the capacity to psychologically regulate it, they're forced to feel it and deal with it. And for many people, especially those that have not had experience in therapy or have been introduced to themselves in some way, might find that overwhelming.
You mentioned something to me in a different conversation earlier, that there's kind of 2 approaches to, well, at least there's one approach that you've been dealing with in kind of evaluating the situation and evaluating, patients maybe that you're even seeing. And you referred to it as psychoanalytical therapy. So you're kind of touching on some of that right now, correct?
Right.
Where you're
Correct.
talking about we're kind of going back and we're looking at more at our personality and our disposition and different things, I guess. And maybe you can explain it better because I'm not going to do a good job of it. So I probably ought to turn the definition over to you. But that's definitely one approach to this that you've been taking and dealing with it. So how about you explain that to us just a little bit more?
Well, I am a trained psychoanalyst, which means my perspective on mental health treatment is grounded in psychoanalytic theory, which is a theory that Freud originally developed that has been fleshed out over 100 years, but centers around the fact that we really do not know ourselves as well or as deeply as we would like to think. Most of our mental life, most of our psychological life is actually in our unconscious mind, out of reach and out of our awareness. And we have ways of keeping thoughts, feelings, experiences, memories in our unconscious mind so we don't have to deal with it. Otherwise, we would really be drowning in too much information and potentially too much pain that we've been carrying around from past traumatic experiences or past difficulties and challenges. So psychoanalytic approaches to working with people, or more specifically thinking about people and pathology, it does rely on helping them understand who they are, why they make the choices they do, to help them understand how their thoughts, feelings, and behaviors are all intertwined. And sometimes in order to change a behavior, we don't necessarily jump in to change the behavior. We have to change a feeling or feelings about past experience in order to definitively help people in the present and moving forward. But in the context of the pandemic, I think a helpful way to think about psychoanalytic theory is that we look at the problems that people have in the interface between who we are, our personalities, our past experiences, and the environment that we're in. And many times we can't change the environment. I mean, I think the pandemic is a good example of an external experience that we have absolutely no control over. So in those types of situations, we have to look internally to begin to address our own vulnerabilities, open wounds, in order to adapt to the new environment that we're in.
And what would be the other side of that? I guess, would that be more of so that's the long-term approach, I guess.
Right.
When you're talking about psychoanalytical approach theory, is that you're really learning more about yourself to kind of bring that to the surface in order to learn how to deal with the present and even in the future, correct?
Correct, yes.
So the other side of that, I guess, which I don't know if a combination of this works or not, but kind of the cognitive behavioral theory, where
Right.
you're that's probably more short-term in trying to correct your thinking, which then corrects, I guess, your behavior. So it's kind of dealing more with your view of the here and now and trying to correct maybe
Right.
an imperception about, or an irrationality, I guess you would say, about the current situation that would cause you to make certain decisions.
I think one of the main differences, cognitive behavioral therapy, to take a step back, psychoanalysis is both a theory and a treatment. Cognitive behavioral therapy is a treatment.
Just a treatment, okay.
Right. It does not necessarily provide us with a theory of mind or a way to think about psychology. It's much more focused on changing behaviors or changing cognition and the way that we think. So some people argue that it's more practical, and I disagree with that. But you're right, it's typically more helpful for people who don't have a lot of time, or certain types of problems that need to be addressed sooner rather than later. Substance abuse, obsessive compulsive disorder, a lot of problems that people struggle with that are really rooted in behavior often need cognitive behavioral therapy to lay a foundation to do psychoanalytic therapy down the road if a person needs continuing work.
Okay. So what do you propose as far as coping, the do's and the don'ts? So as we look at, I mean, I guess, would you agree that we're probably still in the trauma phase of this pandemic?
Absolutely. I mean, I think people are still getting infected and dying.
Right. And so the trauma phase, what really kicks in is just the mode of survival. So our brain typically is very active at that point, and we're dealing with stressors, but in some respects, it's just a matter of survival, and we're still in that heightened sense of emotion. So as we kind of go into these next few days or few weeks, still very relatively uncertain about, what does it look like going back to the mall? That was a discussion a couple of weeks ago with Commerce Lexington.
Right.
What's that going to look like? How are we going to manage that? Is handshaking, has it gone away? Is this going to have a long-term impact on certain norms, societal norms like hugging, or, however our greetings are going to be. It's interesting. So as we get into that, and we're dealing with it, I guess that's described as somewhat, as we're coming out on the other side of this, trying to get into the new norm, that there's going to be a valley that we may hit where all of a sudden all the emotions that we've had at the height can kind of lead us into a depression, I guess, is what we need to be conscious of as we go into these days, is that we may not have experienced the full ramifications of our emotions just yet.
Right, and that's very true.
Then we're going to come out of this trough, and it's like, how do we find the baseline? How do we get or is it a whole new baseline altogether?
No, I think there will be a new baseline, and that is part of what we are struggling with now with regards to the uncertainty. We don't know what the future is going to look like. We do know that it's going to be very different, and I do think we need to begin anticipating kind of a new baseline, especially in the context of social interactions. Even basic things like shaking hands, or how we stand in line in public, or attending concerts or sporting events. This is going to have effect for years, and will hopefully inform the next pandemic as well, because this is likely going to happen again. And we need to do the best job that we can now to learn as much from this experience so we could rapidly apply it to the next one.
Okay, so while we're at the peak, and we're still at the peak, I guess, because we really haven't seen kind of a full phase in, or at least maybe today was supposed to be the first day kind of is moving forward into this phase in. So are there different do's and don'ts for each period? So as we're sitting here at the height of emotion, kind of at the peak, starting to realize what this is at least all about, and life has kind of stood still, versus when we get into the valley, the do's and don'ts for both, are they the same? Are they different? What do we need to be doing to learn to cope?
I mean, what is interesting that I have noticed over the past couple of weeks is that, like the Washington Post study, there is an increasing divide in our approach to the recovery based on our political affiliations, that, I think is something we need to begin to think more about, spend more time looking at. For example, I was kind of at Lowe's this past weekend. I had to run an errand, and it was very striking being in a public space for the first time in probably 4 or 5 weeks. And some people were wearing masks, many weren't. And there was this sense that you could almost tell a person's politics based on how they were interacting with each other, how they were dressing, the social distancing. And I think that's going to have a profound impact on the speed in which we recover and how we approach that. There is a spectrum that we have noticed with regard to people's anxieties that range on one end from absolute denial of this being a threat. Those are the individuals who are claiming that the lethality of this is no different than the seasonal flu, to those on the other end who are in extreme panic over this and are completely paralyzed and unable to leave their house. Both tails of that bell curve are problematic. We want everybody to be a little bit anxious and vigilant. And we want people to interact in as much of the same way as possible. Personally, I'm very comfortable being out in public when I feel like everyone around me is a little bit nervous. They're the ones kind of maintaining social distance. They look over their shoulder to make sure the person behind them is at enough distance. These are the people that are using hand sanitizers as they come and go. Personally, I find that reassuring, as opposed to, I think, those on either end of the spectrum, where panic leads to a lot of hostility and aggressiveness in public, and denial leads to kind of complete disregard of other people's safety. My concern is that the tails of those are going to become more polarized over time, especially in the context of modern politics. And that's going to have a profound impact, I think, on how we recover and how safe people are going to be going out to the mall, to sporting events, and into public venues.
Okay. Well, it's definitely going to be a challenge. I think, again, part of this kind of series was really to build perspective. And I guess it's kind of unfortunate. I mean, we have, if you're saying that there's evidence that this kind of falls, along party lines as to how we're all kind of reacting to this. Doesn't mean, however, that we don't need to take a step back and just have an overall consciousness of humanity, which shouldn't have any dividing lines whatsoever in this whole thing. And that, I think, is going to be helpful for just the healing overall, just the psychological healing overall, as we try to face this as a nation, that we've got to move forward with just a little bit greater consciousness of each other's and each other's perspective and each other's realities. I used to say all the time, and I still say it, is that other people's perspective is their reality. So whether it's reality or not, it is for them. And we have to appreciate that. And we have to build some kind of tolerance level for the fact that there's going to be people that fall along various points in that spectrum that you just talked about. And it may not line up with ours, but at least we have to be respectful of the fact that there's a reason that they feel the way they feel. There's a reason they're experiencing what they experience. One of the things that you mentioned earlier was even the ways that you're seeing people who are even responding on the front lines. I mean, there was some news, I believe it was a few weeks ago, about the 2 healthcare workers in New York City that committed suicide as a result of what they're having to face. And of course, those folks, that are on the front lines are, if they weren't burned out before, they're probably on the verge of being burned out now. So, you happened to mention that earlier, that's been an issue, and some of the emotional consequences of those people who are working on the front lines. And what else is kind of being revealed about that? What are you seeing, or are you seeing anything on that side that we need to be conscious of? And
absolutely. And I mean, I think what was alarming about those suicides, I mean, not only were they frontline workers, but these were also individuals with no history of mental illness, no warning signs. People on the front lines, EMTs, nursing staff, physicians, especially those in places like New York City, are getting hit very hard. Talking to colleagues who work in New York, it feels, they paint a picture that feels like a foreign country compared to what we see in Lexington. We have not, fortunately, dealt with a surge here that we were anticipating. However, New York did experience that. For example, there are numerous colleagues act as peer support consultants for frontline employees in New York City. And they're now creating groups to help those peer support specialists as well, that dealing with so much trauma is now crossing over layers of mental health care support. There was a study published in Journal American Medical Association 2 weeks ago that looked at the psychological and psychiatric effects of front care workers in China. And they surveyed, believe it was several thousand nurses and physicians in China from Wuhan to Beijing. It was a nationwide survey. But they also tested and screened individuals for depression, which makes this study a little bit unique. And they found that 70% of the individuals that they tested scored positive for psychological distress. In half of those that they tested actually screened positive for depression, which is a devastatingly high number. They also kind of broke down the study to look at factors that made people more susceptible to depression, and found that typically women, which I think probably has a cultural impact in China that might not translate here, but those that have less authority in the hospital, typically techs or nursing staff, were at much greater risk. And those geographically closest to Wuhan had the highest risk as well. So it does paint a picture of the severity of what frontline workers are facing, but also who is at risk. And we need to be able to identify those and to screen those individuals here much more closely.
Yeah. Well, even though we're not the epicenter, there's still evidence that there's quite a bit of stress that's still on our
Absolutely.
healthcare system here in Lexington. And I think it would be really helpful for, you know, as we think about that, and maybe we're not having to deal with the same number of patients, you know, that are having to be dealt with in the epicenters, but that just kind of accentuates that much more, that the more appreciation, the more that we can kind of step outside ourselves and you know, congratulate and show our gratitude and acts of kindness and things like that, particularly with those who are having to face that, becomes that much more critical, at least here in Lexington, as we, you know, we look to try to support everybody in this. So
and I think that really is important, because another concern tied to this is actually, I think a lot of healthcare workers across the world are being stigmatized. People are afraid of that they might be infected, or keeping extra distance. And even this morning in the New York Times had an article about frontline workers in Mexico who were assaulted.
Wow.
So there is a lot of risk of kind of alienating those frontline workers. So you're absolutely right. We need to be very vigilant and be as supportive as possible.
Well, so we, you know, in preparing for, you know, what we're going through now, as we're kind of in that traumatic phase, and as we might kind of head into this valley, as they're calling it, to where we hit into depression, what are some of the positive things, or, you know, some of the things we need to be avoiding, ways in which, you know, that are only going to, you know, if we continue down certain routines and habits, is only going to lead to you know, more of a dark side to this thing. So what do we need to be doing to get on the other side of this?
I
and
think
to be
that,
coping more, I guess.
I mean, certainly the silver lining to all of this is that we have the tools needed to address this. You know, unlike COVID-19, you know, this is something novel we've never seen before. A lot of work and energy is going into understanding this. Testing is limited basically by a lack of knowledge and a lack of ability to manufacture swabs and reagents. With this mental health pandemic, we need to begin screening people much more heavily. You know, much like COVID, people talk about testing. We need to talk about screening heavily. Fortunately, screening is very easy to do. We have numerous tools. Most of the time, there are questionnaires that run between 5 and 10 questions that have been validated and we know provide a lot of important information and are easy to deploy. We just need to begin thinking about how to do that. Obviously, primary care clinics are a wonderful option as far as screening, but you know, people can screen themselves at home if they're worried about themselves or a family member. SAMSA, the Substance Abuse and Mental Health Administration, a branch of the Health and Human Services, has all of the screening tools you need on their website. You can just search their website for screening tools and look for those that can test for anxiety, depression, trauma, substance abuse. It's a wonderful resource. And oftentimes when people take these screening tests, they're surprised at the answers that they get back. I mean, I hear very frequently, you know, my family doctor gave me this test and I was shocked by the result. And maybe there are things in my life or within me that I need to address and had never thought much about.
Okay. So if we have, you know, a family member or a friend or anyone, loved one that we're, you know, that we're kind of having to deal with and help, what, you know, if we see that they're starting to move into that spectrum of irrationality or unhealthy anxiety, unhealthy behaviors, you know, what do we need to do or what can we do in that respect?
Well, I think first of all, it's always important to identify the emergency. You know, in this context, being suicidal is a psychiatric emergency. You know, for individuals who are suicidal, who have voiced it, or family members are extremely worried, or if a person is struggling with suicidality, I mean, going to the emergency room is probably the best option. However, we also realize that that's not always a clean option. This is not like a heart attack where everybody universally understands they need to go to the hospital. There are other emergency resources that people should be aware of. One of them is a National Suicide Prevention Lifeline. I've got the numbers if you would like to put them out there.
And to that end, anything that you would have by way of reference, by way of websites or any reference material.
Oh,
We always
sure.
make notes available and
Okay.
links available on the show notes to the YouTube channel, or when we post it to the website or Facebook. So any of those that you're willing to share and aggregate for us, that would be great. We're happy to disseminate those when we disseminate the video too. So,
Okay, yeah, absolutely. Well, the
that'd be great.
National Suicide Prevention Lifeline is an option. The SAMSA has a disaster distress helpline that actually is designed for these types of public health crises. Both lines are available 24/7 and staffed by people trained to handle psychiatric emergencies. Now, beyond the emergency, most people are looking for somebody in a clinic setting or an outpatient setting to get an evaluation, ideally as soon as possible. I will say that's often a challenge in Lexington. We do not have as many psychiatrists or mental health care clinicians in the community as we would like. A good option for Lexington is actually Psychology Today. It's a website that therapists, psychiatrists, psychologists can subscribe to put contact information online, so people can search for mental health treatment within the community. It's also important to keep in mind that there's a wide variety of treatment options available. Some people have strong preferences between talk therapy and medication. Others don't. Some people actually don't know what they need and are just looking for an evaluation. But in general, there are psychiatrists like myself who went to medical school. Some of us did additional training afterwards in psychoanalysis. There are actually, I think, 4 or 5 psychoanalysts in Lexington, which is a large number for a community this size. But most psychiatrists, they focus more on medication management and less on therapy. Psychologists go to graduate school and usually get a PhD or PsyD and are trained in psychological testing and psychotherapy. Social workers have a master's degree and are licensed as well, and primarily do psychotherapy or a lot of work with families. And then there are a host of other kind of master level degrees like clinical counseling that typically require a little bit less training, and their work is much more focused, say, on things like substance abuse.
Okay, well, those are some good resources. And of course, I understand that those are really critical and crucial when we start to see people that maybe are experiencing one side of kind of beyond the middle on that spectrum and headed into that. For the rest of us who may not be that severe, you have any kind of parting, do's and don'ts as we kind of wrap up? Because I know you've got to move on here at 3 o'clock.
Sure.
So I want to respect that time.
I mean, I think for those that don't necessarily feel like we need an evaluation but are struggling, being socially connected is the most important thing that we can do. Reaching out to friends, to family, but also letting people know that you're in distress or hurting. Mm-hmm. The worst thing that I think anyone can do in a situation like this is try to hide or bury their feelings. As we often say, when we bury feelings, they just come out later in uglier ways. And the more that we can talk and be honest and allow ourselves to be vulnerable with those who understand us, the better off we are.
Absolutely. Absolutely. Well, I appreciate your time so very much. It's very generous of you to share that with us. I know you've got a very busy schedule, and even us trying to coordinate this was a little bit of a challenge because of your schedule. So the fact that you took this time is not lost on me and not lost on all of us. So we appreciate it very much. And we want to encourage everybody just to be definitely, as this month is Mental Illness Awareness Month, just everybody open their mind a little further to those that might be struggling in your awareness and vision. And let's all try to reach out and help each other during this time and recognize that there's still going to be challenges to come as we look for kind of a new baseline of life, a new normal. And we're all going to be faced with that challenge, and we all need to be supportive of one another. So we appreciate everybody attending today. If you have any questions, you can certainly forward those on to us. We'll make some of the resources available that Dr. Tuttle has mentioned on our website, on YouTube, on Facebook, because we want everybody to have access to that information so that they'll better educate themselves, maybe better understand what they're going through, and if nothing else, can help someone else. So again, we appreciate that time. Thank you again, Dr. Tuttle, and thank you everybody
Thank you
else
very much.
for being here. And we look forward to seeing everyone next time. Everybody have a great rest of the day, and let's be supportive and thoughtful and keep everybody in our prayers as we all face some very, very challenging times. Thank you, everybody. Appreciate it. Bye-bye.
All right, thank you.